spine is the protection to the spinal cord, which is inside the bone. Head injury in children, 90% is trivial, so the child will not have any difference as behaviors before and after. The helmet's wearing is self-protecting measures which will avoid a large number of deaths in young population, in teenagers.
It's an honor for me today to introduce Professor Franco Servadei. Professor Franco Servadei is a professor of neurosurgery in Humanitas University in Milan, Italy, and he's a visiting professor at Northwest School of Medicine also. So we are very lucky with that. Also, Professor Franco Servadei has been a past president of the World Federation of Neurosurgical Societies, which is more than 100 societies across the world are part of that. And also, Professor Franco Servadei is involved with a large number of global initiatives to ensure global neurosurgery so that neurosurgery can be brought to different countries of the world which do not have them or lack in them. Thank you, Professor Franco Servadei, for joining us here today. We would like to ask you some questions related to neurosurgery, neurotrauma. What do you think are the real causes for neurotrauma across the world?
Well, they differ. In the Western world, the age of our patients increased. And with the last study we did in Europe, the mean age was 55 years, which is quite a lot. Mean age means comorbidities, means anticoagulants treatment, means fall as the first cause of trauma. In the other parts of the world, like the one we are now in Pakistan, the main cause of trauma usually is car or mopeds accidents, and the consequences are different because obviously the population is much younger. We almost don't have comorbidities, and the treatments are different. Even a recent study has shown that the type of trauma is different and the type of lesions are different. So we cannot say that all over the world we have a solution which is the same for any part of the world. The type of injury and the type of lesions are different, and we need to work together to understand and solve the differences. But here, let's say accident related to roads are the most important cause.
Very true, and of course people here don't wear helmets or seatbelts either, so that's a big problem also.
Well, we have shown in my country and in many others that the helmet's wearing is self-protecting measures which will avoid a large number of deaths in young population, in teenagers especially. And seat belts are important for any type of car crash. So these are two very simple measures that are able to make a very important difference. So we need a prevention campaign to induce people to use it.
Yeah. So, infants or children are very difficult to figure out, and if a parent suspects that his baby has had a head injury, what should the parents do?
Well, usually the head injury, it's in children, 90% is trivial, so the child will not have any difference as behaviors before and after. So, they can look at the head and see if there is a bruise or a wound or anything which is making them suspicious. The most important symptoms in children are fatigue, slowly losing possibility to collaborate and trying to sleep, which is, if it's unusual for a child, trying to sleep or sleeping during the day, this is a very important symptom. Then there are more severe symptoms like blowing of a pupil or whatever, but the most The initial one usually is drowsiness. The patient, the child is trying to sleep too much.
But if they're worried, they should bring their child to the hospital straight away.
Yeah.
To be checked out.
I would say in case of any doubt, it's better to bring a child who don't need to the hospital than not to bring someone who needs it. Usually children have epidural hematomas, and this type of hematoma, as you know, can be treated with very good results. So if we arrive early, then the patient is completely cured. So bringing a child to the hospital as soon as possible is important.
So in our country, in Pakistan, and I'm sure in some countries also, people really are not very careful with their backs. And we get a lot of patients with backache, back injuries, and they cannot really differentiate between what spine is and what spinal cord is, and they will tell you that, my spinal cord is hurting, and maybe you can briefly explain the difference.
Well, spine is the bone, meaning the vertebra. They constitute the protection to the spinal cord, which is inside the bone and is protected by the bone. So there may be a damage to the spine without a damage to the spinal cord. So the patient is suffering backache or, let's say, cervical ache, but not suffering neurological disease because the spinal cord is spared. Whereas there may be a condition in which a damage to the bone is accompanied by a damage to the spinal cord. In this case, the patient has difficulties to move legs or arms. The two things are completely different since the spine lesions or damage, both traumatic and spondylotic, are very frequent. A damage to the spinal cord is rare, luckily. So the two diseases are completely different, even epidemiologically speaking.
And then we get a lot of patients with spinal trauma, spinal cord injury, spinal cord damage. What are the chances usually then of recovery if somebody is paralyzed and cannot move his legs or cannot move his arms and legs both?
Well, there is a huge difference between what we call a complete spinal cord damage, a complete transaction of the spine cord, and a partial one. A complete meaning there is no movements below the level of the injury, and this is persisting for hours. Usually this is very difficult to recover. Even in spite of surgeries, in spite of any best medical treatment we can offer. But if, even in part, the lesion is partial, meaning the patient can have, let's say, small movements at the extremities, very limited, but this means that the way is open. And the recovery after surgery and treatment may be good. So, but at the beginning, for the surgeon, it's very difficult to differentiate this situation. So we should do our best anyway. And then only the outcome may be different. But at the beginning, it's almost impossible to say this patient is hopeless or this patient will receive cures.
And I presume that even if somebody is totally paralyzed, he should continue to get rehabilitation and physiotherapy to make sure that his muscles are supple and they don't get...
Well, the physiotherapy and re-education and rehabilitation are extremely important. What we have to say that trauma is a disease for many physicians and is a disease for a long-care term cure, is a disease where we should work together. And having the second step of rehabilitation after the acute phase is for the outcome and the prognosis of the patient as important as the first step. They have to be accompanied and to work together.
Yeah. So in the past and still today, when a patient is operated for a brain tumor, so the incisions are usually very long, and people wonder, is there any other way so that the incisions are smaller? And I'm sure they are now. What is your opinion?
Well, there is a tendency now to be as small as possible, because our microscope, last generation microscope, micro navigation, brain navigation, exoscope, any kind of technology we have will tell us exactly where is the lesion, and we don't need anymore to search for the lesion with large approaches. We can reduce the approach. The other way around is in emergency. In emergency like trauma or intracerebral hematoma or whatever, we have to be ready for doing a second surgery, which is the decompression. So the bone flap has to be large. So there is a big differentiation between elective surgery, where we are moving towards small bone flaps and small approaches, as compared to emergency surgery, where we still are at the level of a large surgical approach.
So as what you're saying is that now precision surgery is coming in with the use of neuronavigation and other facilities, and it is easier. Also, I would presume, and maybe you will tell us, that the complication rates in the past and now, are they different?
Well, we have had a slowly reduction of the complication, slow but significant reduction of the complication, because we know better the anatomy, and we know better the localization of the lesions, and we know better which way should we use to reach the lesion without making damage. So I think now the number of complications related to not precision approach are decreasing tremendously, and also the complication related to infection, because we know that the largest the approach, the higher the number of infections. So they are both reducing.
Yes, thank you. Also, there's some question, some parents, about babies with hydrocephalus, where they have blocked ventricles, and in the past, the majority, all of them were treated by putting in shunts, ventriculoperitoneal shunts, and there was a tendency or chances of them getting infected because of not having good sterilization, or because the baby might not have would not be having sufficient, might be immunocompromised. So what are the solutions there now available for that?
Well, recently, in the last, let's say, 20 years, the anastomosis between the third ventricle and the basal system, which is called third ventriculostomy, ETV, it's which, because it's done endoscopically, is not done with open surgery. We use an endoscope where we go through the foraminum moro. We reach the floor of the third ventricle with only one small burrow and a flexible endoscope, and then we open the floor of the third ventricle into the basal system, and this makes a sort of bypass in the obstruction, which is usually in the aqueduct. So we do bypass the obstruction, and we don't need any more shunts. This is not always possible. We know that in some cases where, for instance, the basilar artery is displaced, is not possible, but usually in many cases it's a good alternative to shunts. at least may be the first operation. And there have been studies, for instance, by Worf in Africa, showing in thousands of cases of children that this operation can be an alternative to shunts.
And previously, there was this concept that maybe little infants, maybe under 6 months age or something like that, maybe ETV may not work. But I presume now that is not, everybody is doing ETVs at any age now.
Yes, it changed. Many years ago, it was thought that very newborn the operation will not work because the connection was between the floor of the fourth ventricle and the cistern areas were not good because the cistern area was still not enough developed. But now we have seen that even if you do at that age, it works. The system works.
Yes, and one final question or asking a comment, and for the public awareness. Some babies are born with a swelling on their lower back, which we call a meningocele or a myelomeningocele, where that babies might be paralyzed and they may not be able to move their legs or be incontinent. What would you recommend to the parents, the mothers who are of the age of birth giving, and to the government? What would you advise? So how can this be prevented most of the times?
Well, the simple maneuvers that we talk today, which is folic acid, very often, and this has been shown in US, because if you go to, let's say, the most rich part of the country in the Northeast, almost non-existing. If you go to South Alabama, these areas, where there is a part of the population who is in poor conditions, very often we have congenital malformation of the spine, like spina bifida or myelomeningocele. So this is related to the assumption of in the food of folic acid. We have identified if the children will not eat enough folic acid, they are exposed. So the folic acid can be given by pills, and it's very easy and it's not costly. And these simple maneuvers that given this advice to the public as a public awareness campaign will work.
And would you advise to the government, like if you remember patients here up in the north area, they would be lacking iodine, and then iodized salt was made compulsory, and now you don't see any patient with a large goiter. So would you advise the government to have a similar folate fortification of different food parts? We know actually in Pakistan there is a law, but the law is not being really followed. So would you recommend to them?
I think the easiest way is fortification of the food you take. So you make mandatory to fortify the food, for instance, grain or corn or any kind of food which is delivered to the population with folic acid. This is the easiest way. And the company producing grain or delivering grain or corn or so whatever, the cost is very limited. So we don't ask them to spend an enormous amount of money. It's a very small amount of money as compared to the revenues of the selling of the products. But the result in the population are incredible.
Thank you so much, Professor Franco Servadei, for your comments on such important topics. Very grateful. So I would like to thank Professor Franco Servadei for enlightening us about brain injuries, spinal injuries, and brain tumors, and of course, of different ways of treating hydrocephalus with babies with large heads. And very important message to the public and to the government, advice on folate fortification so that babies with swelling on their backs, they are not born. So all mothers of childbearing age must take folic acid and to prevent this thing. Thank you.